And I can do that.
Okay, meeting will please come to order. You too. Okay, first, try to give a little speech. I want everybody here and department heads and so forth to realize that I have a lack of hearing, good hearing, okay? I've been trying to cure it for the last couple of years, tried different hearing aids and all this and that. So be kind with me, okay? That's all I ask. Thank you. Okay. Minutes to approve is first.
Second.
Is there any discussion? If not, all those in favor, aye?
Aye.
Okay. No appointments. Discussion, is the sheriff here for the discussion?
I am on.
Yes, sir, go to it.
Go ahead, Brian.
Good evening. You wanted me to speak relative to mobile crisis?
Yes.
Okay, I think if I understood right, I thought the plan was to speak to the potential costs and the financial impact, which I was hoping that Ray Bizzari was going to be on to speak to that. I can't really speak to the cost, but is that what you were looking for me?
I believe so, yes.
Okay. I would have to defer to Ray to speak to the cost. He has the quotes and could speak to the financial impacts if we were to move forward.
So I'm on, everyone. Can you hear me okay? So
Yes.
Okay. So I think that we kicked around some dollar amounts at Health and Human Services. I wasn't at Judicial and Public Safety. To make it go 24/7 and be available to law enforcement and the community as well. The overnight, to expand from 11 o'clock at night until 6 in the morning, which is the time that it doesn't operate. It doesn't also operate 8 to 5 during the week. Folks are transported to the clinic. So the proposal is altogether it's a little under $300,000 to go overnight and then establish those two teams, child welfare and adult protective services with therapists to respond during the day. From a perspective of whether or not it can be sustained, I think that during the day is easily sustainable. We have special rates outside of the startup money. There wouldn't be any more money invested in those two teams. The overnight, their Medicaid projections, I sort of was thinking about this. So just the caveat is, the financials and how mobile crisis is funded from multiple funders across the region. It's always sort of challenging to put things together in a way that you can reconcile all the different funding sources and try to get a good picture of sort of what's going on. I think we're getting there. It's new, this kind of a funding model. It's very challenging, but it's exciting in the sense that it reduces local costs and makes things a little bit easier to sustain. So the Medicaid revenue that they projected for the overnights, I thought was a little low. But then when I think about it, they're really not sure about, what the call outs are. So I think from a sustainability perspective on the overnights, if it gets integrated in a proper way with all the other funding sources, the Medicaid revenue from the other hours, there's quite a bit of Medicaid revenue from 5 to midnight and on the weekends. And I think they're getting Liberty Resources as a contractor. They're getting really good at figuring out how to provide a constellation of services that maximize the Medicaid revenue. So I think that some of that revenue ends up bleeding over into the overnight into the overnight sort of expenses. So, you know, that's the startup dollars, a little under 300,000. I'd like to massage them a little bit to get them to in a really clean way. And I think it's a really important thing to do. Obviously, the police need the support. I mean, we saw again another person with some serious mental health issues, taking hostages, and it's pretty. I mean, Brian knows it's pretty dicey out there. There's a lot of stuff going on. People are sort of coming apart at the seams in some way. This would be a good resource. It also is a good resource for the community in the sense that, you know, if they can call directly, which is part of the plan, then they don't have to call the police all the time, and maybe over some time we can reduce their call outs and let them, you know, get back to policing. So if you have any, I mean, I would want to get a finalized budget from them. I think that's not hard to do. I think it would be good to move on this as quick as possible because there's some little startup time and give these guys some break, particularly with the summer and the warmer weather coming up. So happy to answer any questions around the financing if you guys have any.
Go ahead.
Yeah, right, it's Andy. This is 300,000 out of pocket, or are you talking about some reimbursement?
So it's $300,000 out of pocket to get it started. It's about $340,000 altogether, probably. That's the Medicaid revenue that they attempt to capture. Hopefully that can happen. I think so this is like startup money, Andy, and then as the year goes on, we take a look at the billing, we reconcile it, and then, you know, it becomes sustainable. So yeah, this is startup money to get the staffing going, get them trained, and then get them deployed. As soon as they're deployed, and I think what's interesting about it is, not interesting, but which is pretty challenging about it, which is kind of cool too, is I think that, you know, with the funding, if it's made available, so what we do is we do in the region, we do like quarterly reconciliation, right? So we don't just say to the vendor, you know, here's the money, you know, and good luck. So we track their Medicaid billing and adjust the expenditure on the local dollars, or in this, you know, in that case regional dollars, but in this case local dollars. You adjust the expenditure, so you could end up being less if it works the way that it could. That's just something you have to, because it is a different way of funding things. You kind of got to work through it that way. It's really kind of the only way to work a way through it, because you don't know who's got insurance, who doesn't have insurance, who's going to give you, you know, all those sort of tricky things that go into that.
Hey, Mark?
Thank you, Mr. Chair. Ray, this is Mark Strong. I want to, you know, be right up front and clear. I support this program, the mobile crisis. Where I'm having some issues is, number one, last week when you spoke, you talked about, you know, 285,000. If I heard you correct, it's now 345,000.
I think I lost you.
Can you hear me now?
Yeah, I hear you.
All right, last week when you spoke, it was 285,000. This
Yep.
week, if I heard you correctly, it's 345,000. I support the program, the mobile crisis. I'm having a little trouble with, you know, the startup money
It isn't.
from, and obviously this program bleeds into the city. Have you spoke with the city about, you know, half the money for this ask, or where are we at with that?
Well, when I was talking about $340,000, that's probably where their budget's going to come in, but that's not what the ask is. It's around 280, 285. It's under $300,000 is the ask. That's Medicaid revenue that in that number, the larger number that I would, that includes the Medicaid revenue, which isn't an expense that you guys incur, you know, with this particular proposal. As far as where the city goes, I haven't really talked to them since the last time I met with them. I don't know if the sheriff has any updates on that or anything, but I do think that, I mean, I support it. It's a county program, and, you know, if the city is going to kick in, that's great, but I think we should definitely move ahead with it. That's to sort of add to that.
Ray, it's Elaine. I guess I thought I was clear, but now I'm a little more confused. You're going to be getting a budget from Liberty Resources that will tell you how they're going to,
We have a budget.
okay, we have not seen any, I mean, I don't, I guess that's the $200,000 ask for expanding from midnight to 8 in the morning. That's where the 200,000 is coming from. Because at the meeting, you talked about this
Yep.
being 200,000 to Liberty Resources to expand
I
overnight.
faded out, Elaine. Last I heard was at the meeting.
At the meeting, we talked about Liberty Resources asking for $200,000 so they could have services from midnight to the morning and
Yep.
expand what they're currently doing. And the other $100,000 I thought was the separate proposal, which was to add 2 therapists to mental health, 1 adult protective worker and 1 child protective worker, so that you can have mobile crisis available during the day. So
Yes.
again, I think, again, depending on the volume of work or the volume of how many people use this and how many of them are Medicaid.
I lost you after the volume of work.
Okay, we won't know whether there's enough revenue to cover our costs. So that shouldn't be the total reason why we're doing this, because it won't cost us anything. But you're asking for $300,000 or $340,000 of ARPA funding so that you can pass those
No.
part of those funds to Liberty and then cover the local share costs of the 2 DSS staff? Is that what we're talking
We're
about?
not, no, we're talking about
Need something in writing.
overnight, right? From 12 to 7 or 8, whatever it is. And then the separate, I think it's like $90,000 to establish those 4 teams. Or the 2 teams with the 4 staff. That's going to generate plenty of revenue, and you won't be kicking in any more money on that part of the 24/7 fill during the day, right? 24/7 is still during the day. This would keep the officer, and then the other money is for the overnight. And then I think there's where you try and attract the Medicaid revenue in a way that you can reconcile the allocation to it. Does that make sense?
Ray, you're cutting in and out. so
Yeah,
we're
we
getting-
need something really in writing
You're
to
getting,
look
we're
at.
getting like the end piece, but we're not getting the beginning of what you're saying. So if we're cutting in and out, I apologize. We can't really hear you.
I'm sorry, I couldn't understand that.
We're cutting in and out. We're only getting the tail end of what you're saying.
Oh, I'm sorry. So I'll just start. So it's about $200,000 for the overnight, 12 to 8. It's about $90,000 for the 2 teams to work during the day. The revenue from working during the day is the most stable, likely revenue that you're going to get, because there's a lot of business during the day. There's reimbursement for those positions. So there's the cost, that's pretty much easy and squared away. The other end on the $200,000 for the overnight, so we have a budget. The budget is larger than $200,000. They're asking, you need the $200,000 of the local funding. The rest of the money comes from their anticipated Medicaid billing. So you're only funding part of the overnight, not all of it, probably about 90% of it, it looks like in the beginning. As they bill Medicaid and get revenue, and we would reconcile the local dollars against the Medicaid revenue. If they earn more Medicaid, they would get less dollars. I guess that's what I'm trying to help you guys understand is how this kind of funding works. So you seed the program to start, and then over time, the money becomes less and less and less local investment, more Medicaid third party billing. The overnights are just up in the air. We know how much business there is during the day, right? Because we just do it. They can go out on any call and get reimbursed on those crisis rates. We're going out
I think I got it.
now doing the stuff now. So that's the overnight stuff. I know it's a little, so really you're about $285,000, $290,000 to get to fund the whole thing fully, get it going. And then, over time you'll get reports based on how it's doing. If that's what the legislature, could be part of sort of understanding how that works itself out. It's just It's just kind of, believe me, I get that you don't know. I mean, we swim with this stuff. This is really challenging to sort of figure it out, and so I get that it would be much more foreign to you than it is to me.
So Ray, basically, we have 200-something thousand during the night, 90,000 during the day. And we're just fronting the money, and then the Medicaid is reimbursing the program back.
Maybe.
So that's why it's sustainable, because you're getting reimbursed by Medicaid. Is that?
Yes, they'll still need to be a mix. So this is where, I mean, I don't want to complicate it more than I need to, but I do think it's important, definitely for you guys to sort of get a gist of it, right? So this is so I think, yes, the short answer is the Medicaid revenue is going to reduce local dollars. Liberty and the region has to look at all of these, because it's all getting chopped up like this, right? Like other counties are doing the same thing that we're talking about doing today. They're getting some funding from the recovery money. They're getting, there's grant money. There's other stuff too. So the whole thing gets cobbled together. So when we look at the Medicaid revenue for the overnight calls, even though they're saying it's low, based on the call outs that they think that they might get, we want to look at the entire program across all the counties and all the Medicaid revenue and all of the expenses to make Liberty whole for it, so that we can track how that works. I think that's what's going to, when it's looked at that way, that's going to reduce the local share and eliminate it over time. So you see what I mean? It's bigger than this. So, but we're looking at it in pieces, which makes it very confusing. And it is confusing. I'd be the first one to tell you that.
Right, I think we would all fare better if you put something in
But really,
writing.
all you're doing is what's that?
I think we would all fare better understanding this if you would put something in writing that we could see with like scenarios and whatnot.
If that's what you guys would like, sure.
Elaine was next.
I think when we're considering ARPA in the way that we've asked everyone else to come forward with the specific proposals, to get something in writing, to figure out what's sustainable, so we can actually have a conversation among us to figure this out and how much it's going to cost for local share. I think that what you alluded to is that local share would be reduced, but not covered completely. So these are all important things for us to figure out. So having something in writing in maybe a formal presentation would be very helpful.
I can, so I think that I know that the sheriff and I know that the law enforcement folks community would like this to happen fairly quickly. So if I got this to you by like the end of business tomorrow, would it still be on track for some sort of action at the ledge meeting next week? Or are you talking about February now? Or is it too early to tell?
February, I would say.
What's that? I'm sorry.
Yes,
Say it again.
Say it again.
February.
Brian, how do you guys feel about that? I mean, I can turn it around really quick.
It's not me. I think Hans is saying February. Hans says February.
Go ahead, Trish.
I guess I just want to piggyback on that. I think we should see something in writing, just so we know what is being proposed, how many years you're proposing to cover it. But I do think there's merit in potentially talking to the city about helping to cover some of this cost, because it is a huge impact on DPD as well. So there's potential there to do something collaborative maybe, and we would need something in writing certainly to present there. So be beneficial in a couple ways.
Well, most of our calls are in the city anyway, and the city's gotten almost twice as much ARP money as we did, for smaller percentage of the population. So it definitely should be.
Hans, this is,
Wouldn't go with it.
This is Brian. Do you mind if I comment?
Go to it.
I don't want to speak for the city, but I have been involved in some discussions where with city law enforcement as well as the city manager and representatives. I think it's safe to say that they would be eager to explore the opportunity to help with some funding. Certainly, I can't speak to any amounts or anything, but I want to make sure as we're moving forward that's clear, because I think they need to be brought into this conversation to see if how that might potentially help us move this forward. I know certainly, funding is a concern, and, I respect that and I understand that. But I don't want to lose an opportunity to potentially partner with the city when I think they're very eager to do something here. So I think, that's something that needs to be explored with the city.
Okay, any further comments or questions? Thank you.
Can I just ask a question, Hans? Can I ask a question real quick?
Wants to ask
So then
you-
you don't need this right up tomorrow then, so it doesn't, not something I necessarily have to do. Lauren can do it.
No. February.
Okay, thank you.
Thank you, guys. Okay, we'll move on. Hartman. Okay, Jennifer? She on? Jennifer?
Yes, I'm
Delgado?
on. I'm
Go ahead,
on. So you have my report in front of you. I really don't have anything to add to it. Does anyone have any questions?
Any questions? If not, thank you. Oh, excuse me, Andy.
Yeah, Jennifer, I got one quick question.
Okay.
I don't know if you remember last fall when I brought it up, the thing about, how there could be a house in the north end of the county and a house in the south end of the county that's the same exact assessment, but they're paying two different tax rates, because of what,
Because of the equalization rates?
be 86%, one might be 98%. I mean, is that something that that you can start looking into and see if we can do? I mean, I'm not trying to give, your department more work. I mean, I don't think we should do away with all the assessors we have out there, but I think we should have a fair assessment across the county.
So that is up to each town to do a reevaluation, which would bring that assessment or that equalization rate back to 100. I'm not sure if what you're asking is to look into like a countywide assessment model.
That's basically what I'm asking, because there's a lot of towns, the reavails in the same kind of time frame as other ones do. I mean, that's why you see some towns getting down into the 80s. And you have other ones that do them every 2 years.
Okay, that's something I can look into what would need to be done. I don't know that it's something that I have any authority to actually do, but I can start to look into it and see, maybe talk to some other counties that might do it that way and what they went through to get there.
All right, thank you.
Okay.
Any further questions? Comments? Thank you.
You're welcome.
David Dempsey, treasurer. Is he on or? Okay,
No
we'll
updates.
go on. Mary Beth Lisa, finance department. She on?
I am. Good evening. You do have my report. I don't know if anybody has any questions. We've been pretty busy getting ready for year end. Auditors are starting their work next week for the planning phase of their audit. So pretty busy for year end, but if anybody has any questions, I'd be happy to answer.
Anybody? I guess not. Thank you.
Thank you.
Diane Ferris, Human Resources. She on?
Actually, I'm
Is she
here.
here? Oh, sorry. Didn't see
I
you.
would introduce myself to everyone. So thank you for letting me attend tonight and the opportunity to be here. You do have the report in front of you. Main thing to add is just that I just began a couple weeks ago, so I'm learning a lot being here. The only thing I'd like to add to the report is that we have also filled the Commissioner of Social Services position. Anyone have any questions?
Guess not. Thank you.
Thank you.
Welcome.
Okay, we're down to resolutions already. Wow. We're not quicker than I thought it would. Okay. Anybody want to move WM1? WM1.
I'll second, Elaine.
Any discussion, any questions? Not, all those in favor, aye?
Aye.
Okay, thank you. Anybody opposed? No. W2,
Move
Second it, Mark.
any further comments, questions? If not, we proceed to vote. All those in favor, aye?
Aye.
Noes, are there any noes? I'm pulling MW3, okay? I'm not happy with what I'm seeing. I think we're building government again with this resolution. It seems like the department under the treasurer was well stocked with the people that we had. Now we have to add another person to it, so I'm pulling it. WM4. Anybody want to move it? Move it, Petrus. The second,
I'll
Second.
Oh,
Go ahead.
I'll second, Elaine, thanks.
okay, any discussion? Comments? If not, all those in favor, aye?
it.
The noes, any? Thank you. W5, MW5,
Move it.
WM5.
Move it.
Okay, second, please. Second. Any discussion on that? If not, all those in favor, aye?
Aye.
Opposed, those opposed? None, carried. Okay, Health and Human Services. Oh, no,
Six.
six.
I'll
move 6.
I'll second it, Mark.
Okay, is there any discussion? If not, we proceed to vote. All those in favor, aye?
Aye.
Opposed, no? Thank you. Health and Human Services,
Okay, I'm not exactly sure how everyone wants me to go about this. There were 22 resolutions on the Health and Human Services Committee agenda. You can see HH 14, that was amended at the meeting, and it's probably going to be needed to be amended again tonight because it was unclear in the resolution that this was intended to be two contract therapists and one part-time prescriber. But then I realized, looking it over today, that this resolution does not include the rates of pay for those particular vendors. And that probably should have been addressed at the Health and Human Services Committee. We had quite a few resolutions come forward. But the contract rate of $65 per hour for the contract therapist should be in here. And if it is amended to go to the full ledge, we'll remove the language about the one part-time prescriber for a period not to exceed 5 years, because it is unclear what the prescriber rate will be. So when they have a prescriber to come in part-time, which was put in their 2022 budget, they can come with another resolution that identifies the rate of pay for that prescriber. So we'll amend this to just say mental health, 2 contract therapists at a rate of $65 per session. Obviously, the rates are needed for, the contracts that are developed, and it's also needed when the auditor goes to look at what's being paid out by the departments and have a resolution to refer to. I did also pull HH 14, or excuse me, I pulled HH 15, which was the original request for $500,000 of ARPA funds. And I pulled it because I think there's more information to be had, perhaps a revision to the proposal somewhat. And there is a lot of information coming in right now on the opioid money that's going to be coming into the community and what will be available to reinvest in opioid related services. So until we're clear on that, I did go ahead and pull that resolution. And then you'll see that HH 17 was tabled at the meeting. This is about accepting money to do a Medicaid assistance program at the jail. It was tabled. I believe the sheriff is going to be working on being more clear on the plan of how this MAT program will be institutionalized in the jail, and that can certainly come back. Also, we added, after executive session, HH 20 and HH 21. And both of those resolutions, after executive session we came back out and the committee moved them forward. One is to appoint the Director of Community Services and Mental Health, and the other is to appoint a Commissioner of Social Services. Both will be in place by the 28th when Ray has his last day here. If you want, I can go through HH 1 through 13, but the majority of those were contract renewals, accepting money for the Office for the Aging, filling of some budgeted vacancies. So if anyone objects, if they don't object, I'd like to have HH 1 to HH 13 moved as a bundle.
Move it, Aileen.
Certainly.
I just want to separate anyone that says create and fill. That's all,
Okay.
just for questions.
All right.
So that would be 3 and 5, Mr. Dennison.
3, 5. Yeah, I guess those are the only two.
We'll do those separate.
Do those.
Okay.
You said 1 through 17
1 through 13.
or 13,
Yep.
excuse me.
Okay. Can we get a motion in a second? And do I do to separate them out first?
So I'll
or-
give a motion to do 1, 2, 4, 6 through 13.
Second by Peaches. Okay, all those, yeah, any discussion? Suzie? If not, all those in favor, aye?
Aye.
Those opposed, carried. Okay,
Okay, HH 3 is the authorization to create and fill a public health assistant position in the health department. To the best of my recollection, the health department was given one additional position in the 2022 budget. And it was either the senior public health assistant or the public health assistant. Do you recall?
I feel like we went back and forth on that.
Okay, but they did get a, I think it was the public health assistant. They did get authorization to create another public health assistant position in the health department. And that's what this position and resolution would be asking for, to create what was budgeted in their 2022 budget.
So I'll move it for discussion.
I'll second.
okay, any discussion on it, HH3?
Yeah, I just, so HH 3 was
Okay,
done in last year's budget.
I have the resolution right here, Andy. HH 3 is to create and fill a public health assistant position in the health department and abolish a principal typist position that was already there and vacant. So basically, they made the case when they came to the budget that they had a principal typist position that wasn't filled. And they asked for permission to abolish that position and replace it with a public health assistant. And from their point of view, it would be more versatility in terms of the work that could be assigned. It was my understanding. Because it says where there's a vacancy in the health department, and that had been vacant since September of 21. It was vacant, a principal typist. After reviewing the job duties, they wish to abolish that position and replace it with a public health assistant. So that's how this create and fill came to be.
What's the salary difference? Do you know? Lenny?
I think it's a 13 and the public health assistant is a 14. If I'm not, yes, 13 to 14.
Is there any further discussion on HH3? If not, all those in favor, aye?
Aye.
Those opposed, carried. HH5,
HH 5 is authorizing the public health director to create and fill a senior public health assistant. This is the case they made, has to do with the lead program, whereas New York State Department of Health has revised regulations lowering the threshold for the health department to provide education and case management to children who have blood levels of 5 or higher. It used to be 15. What the public health director desires to create and fill one full-time senior public health assistant to provide oversight and case management for the lead poisoning prevention program. And the funding for this position was put in the 2022 budget, and that's basically the case they made for the additional position to work on the lead work.
I'll move it for discussion.
Is there a second?
Second, Mark.
Thank you. Okay, discussion on it, please.
So this was already in the budget too?
No, this was a new, my understanding is this was a position that was given to the health department at the time of the budget. There were certain positions that were budgeted for in the 2022 budget. This senior public health assistant is a new position. And basically, I believe at the time of the tentative budget, they must have made the case that instead of filling it with a nurse, they thought a senior public health assistant could do the work to meet the requirements for the home visiting for these kids with high lead levels.
My question is, why does it have to be a senior public health official? Why do we have to have a title senior? And that's confusing me.
It says the Civil Service Commission reviewed and approved the duties and classifications of the full-time senior public health assistant. Could be the scope of work that they were given, Mark. I'm not totally sure.
Is there I'm assuming there's a pay difference between a senior health assistant and just a normal assistant?
Yes, I would
health
assume
assistant?
that's probably true. I don't have the authorizations to fill, I don't think behind these, probably took them off. But yes, there is probably a difference in the grades from senior to assistant.
Thank you.
Go ahead, sir.
Did you also say that during the budget time, they deleted a nurse position? And that's how it made the budget? Or didn't I
That was
not
the other
hear
one
that
she
right?
said. That was
Yeah.
a typist.
Yeah.
They
No, the
deleted,
typist was for the previous.
Yeah.
Public health assistant, for the senior public health assistant.
they did come in initially with 3 budgeted unfilled nursing positions, and there was some movement in that, but I don't know that it was a direct reflection of this.
But what you're saying is that this is in the budget,
This was,
even though it says create and fill.
yes, it wasn't in 21, but when the 2022 budget was passed, the funding for this position was included.
Is there any reimbursement on that funding from the feds or the state?
There's a lead grant that I would assume will pick up some salary and not fringe, but salary for this. And then anything that is deficit funding is eligible for 36% reimbursement as core public health work.
Anything?
I don't remember the conversation about when the state changed the threshold from 15 to 5. And if there was a certain amount that was being granted to everyone having to deal with the extra caseload.
Additional lead money? you mean?
Yeah, I just didn't know. I don't know if you know that.
No, I would
I'm just
assume
curious.
some of this is
Because I
in,
know that.
there is a lead grant that has revenue against. I don't know the exact amount of it.
Mr. Chair,
Go ahead.
can I make a motion to table this to the full edge next week for more?
I'm on the call if you would like to ask me questions.
Go for it, Kathleen.
So to answer some of the questions, yes, the senior public health assistant was approved in the 2022 budget, as Elaine mentioned. It was created and we will be paying for a majority of the salary and fringe through our lead poisoning prevention program. And what is not approved, what is not covered through the lead poisoning prevention program will be reimbursable as 36% at 100% under our grant, and then 36% when we outdo our grant, because this is a mandated core program, is our lead poisoning prevention. The senior aspect has to do with the responsibilities and duties that are required of this person. They'll be talking with doctor's offices, with families, making home visits, maintaining the required documentation and reports to the state. We more than quadrupled our lead poisoning cases when the state did change the minimum lead poisoning levels. And this is impacting every county in New York State, as you all know. This is our attempt to try and meet the deadlines, the timelines and requirements as part of that. There is a lead poisoning prevention grant, which has not been sent out again. There has been requests for additional funding against that, but we cannot guarantee that will happen. The state has not released that yet.
Anybody else? Did we have a second to the table?
Well, I would second the table, but I do have a question. If I may.
Well,
I don't know.
Guess I can take the table away. She just explained.
You happy with it? Okay. Table's been removed. Go ahead, Mark.
Kathleen, this is Mark. And again, I'm only hung up on the senior part of this. Is there like a huge, job description difference between a normal health assistant and a senior? I'm assuming there is, but I mean.
There is. And I appreciate you asking that. So as you identified previously, the public health assistant is more akin to clerical support work, whereas the senior is about 3 grades higher and would be more independent, and then would also have the ability to provide some supervision to public health assistants as well, which is certainly different than purely clerical support work, and a lot more flexibility, a lot more independence and responsibility in interacting with our state people as well as our healthcare providers directly. Whereas we would not ask the public health assistant to do that. There is education and experience that comes along with the requirements for the senior.
And they would only be working with the lead paint program. They wouldn't be supervising other subordinates in other areas of the health and human services.
So the job description is written that we could have some flexibility in that if need be, but right now our lead poisoning caseload is such that it would be consumed by that at this point in time. And we don't foresee that changing, unfortunately. We also are working with the city who just received, not with the city, with the Housing and Urban Development Home Headquarters, who just received a significant grant, and they will be letting that be known, and that will be providing some additional, not reactive, but proactive lead poisoning work that this role will be directly involved with.
Thank you.
Any further discussion? Anybody?
Yeah. Sure.
Go ahead, John.
So this position then is gonna be from now until infinity. It's just an added position to our manpower. for running the county. Never goes away.
Any further questions, comments? Otherwise, we'll proceed to vote on HH5, I believe, right? Yep. Okay. All those in favor, aye?
Aye.
Anybody opposed? Opposed. One opposition. Okay, thank you, pass. We'll go on to
Great.
14.
Yeah, there's 14 I discussed, where that was going to be to enter into a contract for 2 contract therapists, remove the language about 1 part-time prescriber, and include the rate of $65 per session.
So you're amending this again now is what you're
Yes,
saying?
yes. And so for at the ledge meeting, it will be in the correct form.
So can you? Is that what you just read then? What the
Yep.
amended would be?
Yep.
Okay. Can you do it one more time?
Yes,
Sorry.
so the resolution is to authorize the chair of the legislature and director to enter into a contract for mental health services. The last resolve says the chair of the legislature and the director of community services be authorized to enter into a contract with 2 part-time therapists for the provision of mental health counseling services. I'd like to say at $65 per session, and remove the language of 1 part-time prescriber for a period not to exceed 5 years. So I'm taking the prescriber language out of there because we don't know the rate they'll be paid.
Move it for discussion.
is there a second.
Second.
Open for discussion. Anybody? Eileen?
Brian's not on the committee.
Oh,
So we can't second. Brian seconded, but he's not on the committee.
thank you.
That's what's hard about us
Thank
sitting
you.
all together.
Welcome.
We're-
Yeah,
that's
We've all done it, so,
I'll second it.
okay,
For about 6 months, a couple of years ago.
any further discussion?
So
We won't know the numbers for a while.
well, when I went back and forth with Ray, I said, we need to know what the rate of pay for the prescriber will be. He said, well, if it's a nurse practitioner or a psychiatrist, they'll be different. And depending on their years of experience, he goes, makes more sense than remove it, and I'll have mental health can bring that resolution back when they have all the detail. So right now, this resolution only authorizes them to add 2 contract mental health therapists. Part-time, under contract, yep. And that was, I believe, put in the 2022 budget when Ray made the case that their book of business was really growing. And instead of adding county employees, he was making the request to add contract therapists and a contract prescriber.
Okay, any further discussion? Not all those in favor? Aye.
Aye.
Those opposed? No. Hearing none, I guess it's passed. We'll go on to 20.
HH 16 is the contract with Liberty Resources for the provision of adult crisis respite. And that is to use $122,000 of their mental health state aid so that Liberty can provide crisis respite, adult crisis respite. It's a contract renewal.
Move it.
Is there a second?
I'll second it.
Okay, discussion on HH 16.
So this is for what we're doing now that we were just talking about doing more.
No, this is, I think it's mental health crisis respite. So when someone's in a crisis, they have a respite place to put
Oh,
someone.
okay.
This isn't a mobile crisis team.
Not the child.
Yeah, this is not mobile crisis. This is a respite home.
Right,
placement.
it's not child respite. It looks like it's an
It's
adult.
adult.
Yeah.
Yep,
It's just the same company.
it's, yes, exactly.
Any further discussion?
Can you repeat again, please? I'm sorry.
Yeah.
Where was the 122?
$122,000. There is state aid money in the amount of $122,000, 692 cents, 692, which can be used to fund adult crisis respite services. And Liberty Resources is providing these services using a peer support model. And this is a request to continue the contract with Liberty Resources using the mental health state aid that comes into the mental health budget to cover the cost of it.
And is this a 1-year contract? Is it a?
This is a 1-year well, yes, 1-year contract with Liberty Resources, yes. I think January to December 31st.
Any further questions or comments? If not, all those in favor of HH 16? Aye. Those opposed? Hearing none, passed.
A 17 was tabled, so 18, this was authorized the chair and the director of community services to accept OMH workforce grant. And I do believe the case that was made is Cayuga County Mental Health was awarded a workforce grant of amount $66,000 to be used for workforce recruitment and retention activities under the coronavirus response and relief supplemental appropriations. It's necessary to amend the 2022 budget to accept this funding. And I do believe that the case was made that it is unclear at this point how this $66,000 is going to be used. But the hope was to at least get it into the budget. And I know Rich worked on this resolution and made sure that the last resolve says that the allocation and expenditure of such funds will be subject to further approval by the county legislature. And that, the other resolve was authorized to enter into any contracts or activities necessary to accept the grant is in a form approved by the county attorney. But, if this is going to be to reward staff, I don't know how it will be used, but it cannot be used independent of it coming back to the county legislature for their review.
Is there a second?
I'll second.
Okay, any discussion on HHAT?
I just have one thing, Mr. Chair. For like this and other things that, you know, I mean, I'm glad the last whereas is there because any grant that, and like all of this, you know, COVID money and stuff like that, I mean, it's eventually all gonna disappear. So if we're adding staff because we have, you know, funny money coming in and then all of a sudden the funny money goes away.
Yeah, and if they were going to identify staff that would be given a bonus or retention, I mean, all of that would have to come back for review. Obviously, the unions would have to be involved in everything. So, you know, this allows them to take the money, but it doesn't allow them to use it without coming back before the legislature. And then, last,
Like,
oh, sorry. Oh, go ahead.
Yeah, go ahead.
Is this grant, did this require any matching funds from the county?
Not to my knowledge, it was a,
100%?
Yep.
60s, okay.
You finished with that?
I am, well, with this resolution, or there's one more.
Oh, we gotta vote on this one.
Yep. All those in favor?
Aye.
Any opposed? Okay, go on
Okay,
to,
the last resolution is to authorize the filling of a supervising social worker position at Community Mental Health. And the resolution talks about there is an anticipated vacancy for this position, and there was a request to get this in motion as soon as possible. The candidate we're recommending come in as DCS vacated this position. So when that individual, if and when that individual is appointed as the Director of Community Services, and that's resolution 20 tonight, they will have permission to go ahead and start making arrangements to fill the supervising social worker position she had.
motion?
Can I make a motion to just bundle 19, 20, and 21 then?
No, I'd like,
No, all right.
I'd like,
I'll make a motion on
20
19.
separated, please.
I'll make a motion for 19. then.
You can do 19 and 21 together. If you want.
No 19. Okay.
I'd like-
I'll second 19.
Okay,
21
any further
time.
discussion? Jim?
No, I'm good. If we're just doing 19, I'm okay with that.
Okay. No further discussion? All those in favor, aye.
Aye.
Opposed, no? Thank you. 20,
Okay, HH 20 is to appoint the Director of Community Services in the Mental Health Department. And the resolution says the Human Resources Department has reviewed the position and has established the position at grade 8 of the comp plan. Part 4, non-bargaining management employees with a recommended salary of $97,000 annually. And if this resolution passes, the appointment will be made for the 28th of January.
Move it.
is there a second?
I'll second. Eden?
Okay, it's open for discussion. Anybody?
Thank you, Mr. Chairman. So obviously, this is a once in a decade opportunity for me to pontificate on the woes of the Director of Community Services being part and parcel of the Office of Mental Health. So I guess my question would be, I realize that the Community Services Board does the selection process for the Director of Community Services. But it is my understanding that the Office of Mental Health is indeed a county department, correct? And so was there a consideration given to the department head? I guess what I'm trying to say is, did the Community Services Board select the Director of Mental Health, or did we?
There was, and I think it was outlined in the local law, I don't have it in front of me, but there was reference that this is a dual position. The legislature should have some input into the selection. Aileen and I did sit on the community with the members of the Community Services Board and conduct those interviews.
And our HR.
And our HR department was involved as well. They had the questions. candidates were selected by this merged group.
So
And
there was the representatives from the legislature.
there was,
consisted
and our
of just
HR
you
department,
two,
and just
and then the community services.
3 or 4 community services board members.
And again, and then I'll stop because I know it's a long night. But I would also say that I don't think it was, and this is not a reflection on the candidate, because the candidate I'm hearing good things about. So I don't want it to be in any way construed as a reflection on the candidate. It's just, I think anybody with ears has listened to me for the better part of a decade now. I do not believe that it's an objective decision-making process when you are the director of community services and also the director of mental health. So having said that, thank you.
Any further comments, questions?
Chair,
Jim?
this is a question of not having a lot. On these appointed positions, are they appointed for a year, 2 years, 3 years?
My understanding, and Chris can correct me if I'm wrong, this is not a required appointment for so many years. It was when Ray had the job because of the DSS commissioner role, and that was the 5-year appointment set by state law. The DCS is not a term appointment. So basically, there is no mandatory term for this appointment. I could say it's at will because I guess there is language in the local law about how you would go about and who would be involved in the decision to terminate the director of community services. But, it gets a little muddy because the community services board hires, fires, and evaluates, but with input from the county because the position is also a county department head. But this is not a protected 4-year, 2-year, 3-year appointment.
Two different.
Right.
Positions.
Any further discussion?
That's 2 different positions.
One is the director of community services and the other is the director of mental health.
But neither are required by state law to have a specific.
Correct. I'm just trying to articulate that they're 2 different
So
positions.
one person's gonna
Fulfill both.
head up 2.
They're going to be the director of community services as set in mental hygiene law. And they're going to be responsible for the development of the plan, for the disability groups, all that goes along with that.
For awarding
Mental
contracts
health,
with
yeah,
whom they're in direct competition.
yeah, mental health powers. And then they're also serving as the department head for Cayuga County Mental Health Clinic.
Any further comments, questions?
So
Andy?
So Chris, and again, I'm playing catch up here, so I apologize for that. What do you mean direct competition?
So the director of community services is responsible for identifying needs within the community and allocating resources within the community to affect those demonstrated needs. Is that fair to say?
With the assistance of the Community Services Board, the DCS moves forward the state. You have to have a Community Services Board in order to get state aid coming in.
To disperse those
Yes.
funds. And as my concern is that when you're the director of mental health, your department is in competition, not for all, but for some of those finite resources.
I guess we looked at this a bunch of ways, and I think your point has always been the way you're making it right now, but as we looked at this and developed the local law, we did not identify another county small rural county where you have a mental health clinic, because some counties don't operate a mental health clinic, that's an optional service. But when they do, the DCS and the clinic director that was the model that was there. But yes, the Cayuga County Mental Health Clinic is in essence a provider of services in this community. But we went through this, yeah.
Any further questions, anybody?
Well, basically, wasn't, I mean, these were all combined before.
This is how, yes.
20 and 21 basically were combined before.
And before,
One person did all,
yes, yeah.
which is really horrific when you stop and
Which
think
is,
about it.
yes, which is,
Any further questions? If not, all those in favor of,
So I'm just trying to educate myself. So all three of these were one person.
okay,
before?
just with Ray Ray before he retired was the DCS, but he also was the Commissioner of Social Services.
And the director of mental health.
Yeah, yes, DCS, mental health, and Commissioner of Social Services. We passed a local law, got support of the legislature to say, this is too much, this is too big. When this local law passed, we made the decision to, instead of having the DCS under local law the way it is right now, we said, okay, when he retires January 28th, we're going to have a DSS commissioner overseeing all of social services. And we're going to have a DCS that is the DCS and the clinic director. We're going to separate those two positions. And that's what these two resolutions are doing. So Ray's going to be retiring January 28th. And he's going, his replacement will be a Commissioner of Social Services, overseeing all of the Department of Social Services, and a DCS over mental health.
And the one is at 97K. What's the commissioner?
That's, let me get to that.
I just need to know for my.
The Commissioner of Social Services is Resolution 21, appointing Christine Bianco as the full-time position of Commissioner of Social Services for a 5-year term, because that is required by state law, that the DSS Commissioner be a 5-year term, with a salary recommended by HR after looking at the grade, her years of experience, as $106,157. So one was set by HR at $97,000 recommended, and the other position was recommended at $106,000.
So was there there was some knowledge that Ray was going to retire, so this is all budgeted?
Oh, yes, yeah.
Okay.
He's been wanting a transition plan for well over a year. So yes, this was, my understanding is there was money for both of these positions put in the 2022 budget, knowing that the separations were going to happen.
So, Mr. Chair, so real quick, without looking it up, maybe you know, if you don't, that's fine. Where does this compare to what
Was in the budget.
Ray was making for all three positions? I can't remember. off the top of my head.
It's way more, right? 'Cause
Yes,
Ray's-
it, you know, obviously,
Ray's
because
like
we're,
120.
I know, I'm just trying to get a feel.
Ray was
for it.
probably
I can't
around
remember.
130.
I think it was 180. Didn't they say 180 in our community?
No,
It was
No.
130.
he was 127 for a million years,
One-
Right.
and then he went up to, he
Yeah,
might be around 130.
that sounds.
Right,
all
and so the bigger cost is going to be in the mental health side, because DSS reimburses salaries and fringes at 75% for the administration. So that was known at the time of the 2022 budget, and these positions were put in appropriately.
Thank you very much.
Yeah.
Okay.
any further comments or questions on HH 20? Hearing none. All those in favor, aye.
Aye.
Those opposed?
Aye.
Okay. Passed. We'll go on to HH 21.
Move it, Petrus.
I think, yeah, okay.
Second,
Second, okay. Discussion? Elaine?
I sort of went out of order, so we
Okay.
just covered them all.
Let's say, I think-
Anybody
No, that was
else?
right, because I wanted
Yes.
to know a little bit about.
Yeah, we got through 19, 20, and 21.
We still got to vote on 21.
We still
Yeah,
got more.
right. So if you just ask him to vote on HH 20,
No, I asked him if you had comments on it.
oh, no, I'm
Okay.
commented out.
I guess nobody.
One minute.
If not, let's proceed to vote. All those in favor, aye.
Aye.
Those opposed? No.
I have a question.
Go ahead.
Is it too much trouble to ask that we include all the resolutions attached to this agenda?
It's what?
Is it too much trouble to ask for all the resolutions to be attached to this, Ways and Means in case we're in discussion, we can all have eyes on the resolution that we may be questioning.
Sure.
Okay, that would be helpful for new people.
Yeah, because I
Especially if you
luckily
missed
had
the
mine.
committee meeting
I'm glad
and you
did
missed the
some-
discussion.
Yeah.
Okay, you can do that, that'd be great.
No, we'll have Max take care of it.
Thank you.
Let's see,
Can't blame it on you.
Yes.
we're done with H&H, so government operations.
Thank you, Mr. Chair. Government Operations has one solitary resolution this month. It has been through committee. It is for the create and fill. It was budgeted for create and fill a senior computer systems technician position in the Cayuga County Information Technology Department, as we briefly discussed during government ops on last Thursday. This is part of the transition from a more county-based IT department to from a contract-based IT department to a more county-based IT department. So I'd ask for that to be moved.
Bundle it.
Is there a second?
I'll second.
Okay, discussion, anybody? If not, we'll proceed to vote. So all those in favor, aye.
Aye.
Those opposed, no. Carried. Thank you. Planning. Who's quick? Oh, what's that? Okay,
Okay, Chairman Petcher, I have one resolution for planning, PL1, authorizing applications for state assistance for household hazardous waste. I know they're looking at new vendor and new vendors, and just making a choice for upcoming recycling services. So this was presented and passed at committee, and I offer that up this evening.
move it.
Second.
Okay, discussion on planning, PL1. If not, all those in favor, aye.
Aye.
Opposed, no. Carried. Public Works.
Yes, Mr. Chairman, Public Works has 5. They all went through committee, passed. I'd offer them as a bundle. If anyone objects, we can separate them out, but they're basically fill positions that are already budgeted for or
I'll move one through
public
five.
hearing.
I'll second 1 through 5. Mark?
Okay, discussion is open on 1 through 5 and for Public Works. Any comments? If not, all those in favor, aye.
Aye.
Those opposed, no. Carried again. Thank you. Mr. Johnson. Judicial and Public Safety, Mark.
Judicial and Public Safety has a total of 9 resolutions. I would like to bundle 1 through 5 and 7, 8, and 9, omitting JP6 in the bundle. They were all passed in the committee. I offer them as a bundle with the exception of JP6.
Move it.
Separated.
Second.
Second,
Okay, discussion on 1 through 5, right?
and 7, 8, 9. right?
Yeah, 1 through 5, 7, 8.
I wasn't sure if I heard that. So 6 is.
It's the only one separated.
Okay.
Just for clarification, JP9, that's the purchase of the car because it was struck. That will need a 2/3 vote because it's taking money out of fund balance.
Right, but not here.
No,
Just
but and we did talk about why it wouldn't come from casualty and liability, but I guess it doesn't really matter one way or the other. I mean, that casualty and liability got $30-some thousand in. And to cover almost the car's 40-some thousand. I was
Right.
just curious why we would take it from fund balance instead of,
Can we ask our attorney that question?
or why, or maybe the budget director is the
And
one.
if Lynn's on, I did speak with her. Is she on?
Right. Yeah, Lynn, I guess, made the recommendation for the sheriff, why she thought this was,
I don't think she's on.
I was just, it doesn't really matter. I mean, it doesn't really matter. I was just curious. Why
Get money
would,
from
why wouldn't we
insurance
take it from
claim.
casualty and
Why would
liability?
that go
Why would we
back
have to
into
go to fund
help
balance?
reimburse?
Unless.
Yeah.
Casualty and liability are mostly to settle claims, to defend lawsuits,
I got that's for JP.
essentially litigation. Somewhere along the way, that was used to pay the county's share of vehicle damages after you get
insurance check. Because of that, the insurance proceeds have been deposited into that account. Probably not. It's not meant to pay for vehicles. It's meant to settle lawsuits. And to provide county self-paid insurance. That's the purpose.
It just, in the resolution, it says, whereas the funds in the amount of 35,519 were paid by our insurance carrier for one marked patrol car and the settlement that paid as a result of the said crash. And whereas the insurance funds were deposited into the county's casualty and liability account. Now, that's why I asked.
Casualty and liability account really is, when you look at all the resolutions that set it up, it was meant for us to be self-insured. So somewhere along the way, some department decided that, well, we're gonna take out the part that the insurance doesn't pay, Eastern Shore, right now here, and we'll pull that out of casualty and liability. That really probably not come from department budgets.
So what you're saying is we should stop putting insurance claims into casualty liability.
I believe
Yeah, I
so,
wouldn't
yeah.
think they'd go right to the department where you get to replace the car. but-
Well, that would make more sense.
Right.
But the next time, if you have a deputy get car hit or something, we need to address that before we,
If I
Should we
may,
be addressing that issue before?
well, yeah.
if I may, and I'm not speaking for Lynn in any shape or form, this car may have been one of the lease vehicles. I don't know if there's an issue there because of the lease. Again, I'm not speaking for Lynn. She would have to definitely answer those questions.
Wasn't she the one to make a recommendation?
We can ask her. And let me.
Ryan,
I'm here.
that's, when asked, you said, you just questioned where you should get the replacement money from, and that was the answer, right?
Correct. I hadn't faced this situation before, so I did touch base with Lynn relative to this question, and that was her recommendation. So I can't answer as to why. That would be a question for her.
David,
Yeah, so do we still need 2/3 on this at the full meeting?
If you're gonna pull out the general fund,
It comes out of
You
fund
do.
balance.
Okay, thank you.
Maybe between now and then, we can get a clarification from Lynn.
okay, where are we? Anybody know?
Sorry.
We separated out 6, all the rest of them are bundled.
Okay,
And so we just gotta vote on the bundle.
Well,
Okay.
can we separate 9 that from that too and get an explanation or, I mean, or is it just something, even with the explanation, it's not gonna change?
No,
That's where you got to, as I understand, it, where the money was deposited to. Therefore, that's where we need to take the money
Okay.
from.
we just need to clean up where the money goes next time, if there is a next time.
So we should do something about that. before.
Yeah, not use that account.
Well, that's what I mean.
Andy, I'm here. Andy, it's Lynn. I'm here.
All right.
Did you have a question?
How did you decide to take the replacement car for the sheriff out of fund balance instead of the casualty and liability account that it got money into? That's the
Right. I
question.
think, the money came in 2020 and it was deposited into that account because it's normally where it goes. And we didn't know that they were going to be replacing it. It just came in at the treasurer's department and we made a routine deposit. So instead of, transferring the money in a different year into a different fund, we thought it was okay just to take it from the general funds balance. We're in a, decent position. It was more important for you to know, I guess, that the money did come in. So we are, we got, I think about 35,000 in a check. So hopefully it's okay with you just to have it come out of the fund balance.
any further comments, questions?
I guess my only question, Lynn, is if it was in this year and it happened again, is that the recommended way to do it? Or you would have thought differently if it was more timely?
Well, in the past, at different times when we knew the check was coming, then the resolution might have been written to put the money into the sheriff's budget and adjust his budget at that time with that money. And then it would have been a revenue into the sheriff's budget. So I guess it was more kind of about timing. you know, now it's the boat, you know, it's already recorded in that account. So I think, you know, if we know in the future, we would maybe handle it differently. We've done it a couple different ways in the past.
Any further questions or comments? If not, all those in favor of everything but 6?
Aye.
Those opposed? Nobody opposed? Carried. Okay, number 6.
JP6, I believe the sheriff is on. He had some further comments on this, not necessarily the position, but with the purchase of another vehicle, patrol vehicle. And if Brian is on, I'll let him explain it. Brian?
I am here, and thank you, Mr. Strong. I had intended last week at Public Safety to let the committee know that with the addition of this position, it would require adding an additional vehicle to our fleet. It just slipped my mind as we were going through all of the resolutions and everything I had to cover. I did budget for this additional position and anticipated using some revenue from either our drug seizure account or telephone revenue account to purchase a vehicle. However, I wanted to be fully transparent that this position, if approved, and would require an additional vehicle being added to our fleet. So obviously there would be, you know, some additional costs in maintenance and down the road, you know, in replacement in the future. But in the initial purchase, you know, I wouldn't be coming to the legislature looking for additional money in my budget. I would have the funding to purchase it, but want to be fully transparent so that the legislature realized this would result in an additional vehicle being added to our fleet for that member.
Oh,
Move it.
well, I was gonna say, I would like to move JP6.
Second, Andy's. Discussion on JP6. Eileen?
Sheriff, I know that we added this to the budget, so we did not budget for extra vehicle.
We did not budget for an additional vehicle, and I had anticipated using one of those other revenue sources, not looking to add that to my budget this year.
So, I'm assuming, sir, that this extra vehicle, even, you know, you have the monies in another account, is gonna be approximately the same price as the one vehicle that is on JP9, is that correct?
Actually, I'm not sure how I'm going to do that. I don't know that I need to have an actual fully marked patrol vehicle for this position. So I'm still trying to look at my options, but I think I can add this vehicle and maybe potentially shift some things around, but maybe look, you know, for a vehicle that's not fully marked. I think I can do this a little bit cheaper, but I haven't determined exactly how I will do that.
Mr. Chair.
Any further questions, discussions?
So if you're pulling this out of, I guess my question is these other funds that you'd be pulling out of, like the phone and whatnot, are those a fairly steady? Would you be asking for the car in the future in the budget? If the other accounts, I mean, obviously, if the other accounts don't have the money, the person's not gonna walk.
No, we have the funding to purchase the car initially, but I mean, obviously, you know, when this car wore out down the road, I can't guarantee that I wouldn't have that additional funding. I might be coming back to the legislature in 4 or 5 years looking for, you know, funding to replace that vehicle. I can't guarantee that I would have that, or, you know, whoever might be in my position at that point would have the funding from those particular accounts. But for the initial purchase of a vehicle, you know, I wouldn't be looking for funding from another source.
Eileen?
Sheriff, I appreciate your explanation, and I will be supporting this. I understand it's an oversight and it's necessary. I'm wondering if we could get an update, a fleet update for all of our vehicles. I don't know how many are left still leased and how many how deep are we in this at this point? So that's, I'm wondering if we could get an update on all the fleet.
Absolutely. And this, I'm sorry. Absolutely. And this is something that planning going into next year's budget cycle is going to be certainly something that we're going to have to start addressing with the leased vehicles. It's going to be a concern. So definitely I can put that all together and send the legislature a list of the vehicles we currently have and which ones are leased.
Heidi?
Would we then ask the same of our other departments, DSS, for instance?
Sure we can.
Yeah, I don't know if any other cars were leased but the sheriff's. I think we just went down that path with them. But yes, we can have the
Did we get, I thought mental health. got
Mental health had some, I thought.
leased, do you
I
think?
thought so.
Yeah.
Maybe not.
I could have swore they, maybe not.
It is only the sheriff's department that has them leased. No other department does.
You could still get a list of their inventory, but I think
Yes, yep.
it was the least. And is the sense that we're just gonna get out of the lease business altogether or maintain a few, or that's to be determined?
Well, it's my opinion, and I'll certainly be coming back to this body to discuss this further. These are equity leases. We'll actually own the cars at the end of the lease. There'll be a small buyout. So I think what we're going to want to do is look at the number of miles on the cars when they come up at the end of the term. I'm anticipating that some of the cars will be able to get a little bit more use out of before we have to replace them. So I think, some may be beyond their useful life, we'll get rid of, but others, if we can get, another year out of them or another 2 years, I think we need to work on getting on a rotation where, we can budget each year, a sensible budget so that, we don't go 2 or 3 years with no cars and then have a huge funding issue that we have to address, after 3 or 4 years. So I think we've got some planning to do, but I think we can come up with a strategy to kind of roll this out so that we're just replacing a few cars each year rather than, 10 cars at a clip.
Any further comments?
That should be done with all of our equipment stuff. It should be a goal. Yeah. 5 years, 5 years, okay.
We've been doing it with the highway.
Okay.
So what about 10?
I don't have 10, I only have 9. We were talking about 6. GP 6.
Yeah, we just got.
We just got to vote on GP 6.
Okay. Any further discussion? If not, all those in favor of JP 6?
Aye.
Those opposed? No. Okay, carried.
Thank you, sir.
Thank you.
To adjourn, Mr. Chairman.
Second.
All those in favor of adjournment?
Aye.
Good night, everybody. Thank you.